Hi friends, I wanted to do a little COVID video today to just give you some updates. So first of all, yes, we've seen an increase in the number of people testing positive in North Carolina. I expect that number to go up over the next 2 weeks because of people being exposed during Thanksgiving, unfortunately, and I hope that that number will stay steady or go down before the typical Christmas holiday. But that's what we're seeing. We are not necessarily seeing an increase in mortality rate, which is good because it means that the hospitals have figured out how to treat COVID for in most cases. Um, but any way that you can avoid going to the hospital or being put on a ventilator is always best, right? So there's a few things that I want you to know. The first thing is I would like you to continue to physically distance and wear a mask. I would like you to continue to obviously wash hands. And if you have a pod, to make sure that you know what the other people within the pod are doing, right? For example, we have three other families that our children visit with them, and we try to stay outside exclusively when we're visiting. We try to keep masks on them just because my kids are little, and when they interact, they're a little bit too close. Um, However, I have asked the other families to stay away from people that may be exposed to COVID. So, if these families are eating inside a restaurant, then they wouldn't be safe people to pod with, right? Um, the other side of that is how to be prepared if you do get COVID. The first thing is that patients that have gotten it have done really well with a mega dose of zinc, so 300 milligrams, but you're not going to do this by yourself. You're going to call me if you get it. Loss of taste or smell, fever, a dry cough, or feeling of the flu, like all of a sudden you got hit by a bus, those would be reasons to call me. Please don't assume that it's the regular flu. Go ahead and assume it's COVID until we prove otherwise. So yeah, mega dose of zinc, 300 milligrams, which is a big dose without copper. And then vitamin D, also a big dose, 50,000 units on that first day that you feel symptoms. Most people feel symptoms come on very suddenly, but not everybody. And then we also add lemon balm or oregano or biocidin 3 times a day. So see if you can have the lemon balm or the oregano oil in the house, the capsules, so that you're prepared. Also, make sure you have the zinc and the vitamin D in the house. We also focus on the gut because we know that in order to mount an immune response to get rid of COVID, you need to have a healthy gut. So any herbs that you've been taking for gut healing already, we would add those or double those. But in addition, if you're not taking any, I would give you some. I also wanted to remind you something that has been talked about, but I don't know if everyone has heard this, is that Tylenol is not an appropriate fever reducer for COVID. And that's because in all cases with viruses, Tylenol actually depletes glutathione. And glutathione is one of our mother antioxidants that we need in order to fight the virus. So getting IV glutathione or taking oral NAC or taking an oral liposomal glutathione, especially the one by Apex that I have here if you'd like some, those are all helpful if you get COVID, but it is not recommended that you actually take Tylenol. And because some patients with COVID have had blood clots, it's also not recommended that you take ibuprofen. So what you should take instead for pain or for fever is actually aspirin, regular aspirin. And then the last couple things I wanted to comment on were the vaccine and testing. So the PCR test, which is the nose, the nasal or the nasopharyngeal, or the saliva test, it can be overly sensitive, meaning it can catch virus particles that are not alive, but you would be considered a carrier for COVID if that comes back positive. In addition, it may not, in some cases, be sensitive enough. And what do I mean by that? If you have a GI version of COVID, diarrhea, then you may not test positive for the nasopharyngeal. Patients have all different forms of this virus, and some of them are not going to test positive for the nasal or nasopharyngeal. So getting tested to know that you're negative to go visit people is actually not a good way of ruling out COVID. And then the other thing is the vaccine trial has started. There's September 17th, they started Pfizer's and Moderna's for the mRNA vaccine, which is definitely the most promising. the results were released very early. And what I mean by that is we won't have safety data or full efficacy data for 2 years. So they released data at 2 months that is promising, but it is not all of the data. What the data has shown us, especially for the, let's see, both Moderna and Pfizer, is that the people in the vaccinated group had a vaccine efficacy rate of about 94.5%. I think it was 95% for Pfizer, but that's for Moderna. So, what does this mean? It means of the people that they polled that actually got COVID, the first 100 people, 90 of those had had the placebo and only 5 of those had had the vaccine. However, this is a much larger trial, 30 to 40,000 people, so we don't have the full efficacy data yet. So I just wanted to point that out. They are being pushed by the press to release information much, much, much earlier than we would ever release information in a vaccine trial. So this could still not work very well. We really don't know yet. The other thing is just that testing wise, in the trial, they are testing antibodies to see if people who get the vaccine make antibodies. And that is a B cell response to the vaccine, which is great. But in order to fight COVID, you also need to have a T cell response. So I'm waiting for data to see if people who get this Moderna mRNA vaccine for COVID-19, do they also make T cells? And I don't know the answer yet. So I don't know really, certainly don't know if the vaccine is safe, and I definitely don't know if it's effective. I had somebody ask me today if it's okay that they're in one of the trials. I think it's fine for certain patients if you don't have autoimmune disease or chronic inflammatory response syndrome. I think some people can certainly be in a trial, but a lot of my patients cannot because they're just not, their immune system is not constituted enough to really be helpful in a vaccine. And I'm concerned that right now, without the safety data, getting this vaccine would not be good for your immune system. So reach out to me if you have questions. I hope that helped cover some of it. Lauren sent out an email about all the supplements that we have for sale. A lot of them are helpful to keep your immune system strong, to keep your stress lower, to help your adrenals during the winter. I would like everyone to feel as prepared as possible and to be able to have things that you look forward to this winter, picking up different hobbies, finding places you can walk in nature. We're lucky because we're in North Carolina and it's not like we live in Maine where it's frigid already. So get outside and get in nature as much as you possibly can. And don't forget to see me to have the zinc level checked and have your vitamin D checked. Thanks so much.